Hello friends, let us now discuss the anatomy of nasal cavity. Okay, so let's first of all look at this diagram. So what do we see? We see that this is a representation of the nasal cavity which has been divided into the two nasal cavities by the medial wall, also known as the nasal septum. Okay, so we can see the two nasal cavities on each side of the septum, and each nasal cavity has a roof and a floor. Okay, the roof we discussed earlier also is formed by cribriform plate of ethmoid bone. Remember, when I taught you ethmoid bone, I taught you the cribriform plate of ethmoid bone, and I also told you at that time that this is the thinnest bone in the whole body, right? So cribriform plate of ethmoid. Now the floor, on the other hand, of the floor of the nasal cavity is formed by hard palate. Okay, just remember, we have studied this in embryology also, the formation of hard palate. I just want to revise for you that the hard palate is formed by two bones. Anteriorly we have the maxilla and posteriorly we have the palatine bones. Okay, so we'll talk about it later on also about the maxilla and the palatine bones, but the hard palate, the floor, is formed by these two bones, right? Okay, now remember, each cavity has an anterior opening which we call as anterior nares. Similarly, each cavity also has a posterior opening which is known as posterior choana. All right, okay, let's have a look at this wall. Which wall? The lateral wall. Okay, so we have seen the different walls. Let's look at this lateral wall. So when we look at this lateral wall, we can see that on each side in the lateral wall there are three flap-like structures. These three flap-like structures in the lateral wall, okay, they are hanging from the lateral wall and they are known as turbinate or concha, right? So three terminates or concha. We have the superior turbinate or superior concha, middle turbinate or middle concha, and inferior turbinate or inferior concha. Okay, so they are flap-like or scroll-like structures which are hanging from the lateral wall. Let's look at another view of this nasal cavity. So what do we have over here? We have a coronal cross-section of the nasal cavity, and we can see right in the center is the nasal septum. Okay, then that is the medial wall. If you look at the lateral wall, you can see three flap-like structures. So what are these flap-like structures? I've already told you that these flap-like structures in the nasal cavities, these are concha or turbinate. So we have the superior turbinate or concha, middle turbinate or middle concha, inferior turbinate or inferior concha. Okay, now remember, the part of the lateral wall which is below each turbinate is known as meatus. What does I mean? That means below superior turbinate we have superior meatus, below middle turbinate we have middle meatus, and below inferior turbinate we have inferior meatus. Is that all right? Okay, so let us first discuss the lateral wall of the nose. Okay, so let's start our discussion with the lateral wall of the nose. As you can see, this is the photograph of the lateral wall of the nose, and as soon as we enter into the nasal cavity, we will find that there are lot of hairs over here. Okay, in the anterior most part over here there are a lot of hairs. These hairs are known as vibrissae. What is the function of these hairs? We know during breathing, when we breathe air, these hairs, they act as filter. They filter out the big dust particles, do not allow them to go into the airway. So they act as filters. Okay, this part of the nasal cavity, okay, or the lateral wall, this is known as nasal vestibule, right? This part is known as nasal vestibule. Now remember, sometimes there can be infection in this region of nasal vestibule. Okay, we can have furuncle. What is a furuncle? Furuncle is a staph aureus infection of the hair follicles. So if there is furuncle in the nasal vestibule, we will call this condition as nasal vestibulitis. Okay, so this condition is known as nasal vestibulitis. We know the most common causative agent is Staphylococcus aureus. Okay, there are a lot of hairs over here. Now, how will the patient present? Patient will have a pain, patient will have a swelling. The swelling will be red, hot, tender to touch. Okay, as you can see over here, patient will come to you with this complaint. Now, what treatment will you give to this patient? See, for the nasal vestibulitis, it's a bacterial infection by Staph aureus, so you'll give antibiotic. And there is pain, so you will also give analgesic. Okay, so you will give antibiotic against Staph aureus, and you will give analgesic because patient is having pain. Now, my question is, what antibiotic will you give? Will you give IV antibiotic, or you will give oral antibiotic, or will you give local antibiotic? Oh, you see, at first look, it's a local infection, at a very, very small place in the body. So why should we give systemic antibiotic? Why not we give local antibiotic only? That should be sufficient. Is it? Okay, that's what we think. But remember, this area of face, the area between the upper lip and the two nasolabial folds, this triangle, this is known as danger area of face. Why it is known as danger area of face? Because it communicates directly with cavernous sinus. Okay, let's look at this diagram. What do we see? We see the face and we see the venous drainage from the face. And what do we see? We can see over here that there are ophthalmic veins. We can see these ophthalmic veins. We can also see the infraorbital vein. And what do we see? We see that these veins are in direct communication with the cavernous sinus. You see, these veins are directly draining to cavernous sinus. So any infection in this area can go quickly to the cavernous sinus. Right? Okay. What else can we see? What other veins? You can see all these veins combining together and coming down as the facial vein. This facial vein, if you notice, it has a deep connecting vein which is known as deep facial vein, which connects the facial vein to the pterygoid plexus of veins. With this pterygoid plexus of vein is also in communication with cavernous sinus. So that means the infection from this dangerous area of face, the infection can go directly through these ophthalmic veins into the cavernous sinus, and it can also go in a retrograde manner. Through the deep facial vein, the pterygoid plexus, it can also reach the cavernous sinus. So the cavernous sinus can be infected in multiple ways. Okay, from the face to the cavernous sinus, the infection can go and we can have cavernous sinus thrombosis. Okay, remember the factor contributing to this infection, the spread of infection from the face to the cavernous sinus. Number one is the direct communication. As you can see, there is direct communication. Number two, we know that the blood supply of the face is high. So the blood flow is high. So blood supply or the blood flow is very high. So because of that, the chances of infection traveling is also high. Number three, we can also see that the direction of flow is towards the cavernous sinus. That also contributes to spread of infection. Okay, remember earlier it was thought that these veins do not have any walls. So this was an earlier thought, right? That there are no walls, and therefore the infection spreads to cavernous sinus. But this statement has been found to be wrong. Okay, and it is a favorite asked question, why the infection from the face spreads to cavernous sinus. Okay, so all these three are true statements and this is the false statement. These veins do have walls. It is because of the communication, direction and flow and the amount of blood flow that leads to spread of infection from the face to the cavernous sinus. Therefore, if we have a patient who's having vestibulitis, we would always prefer to give this patient systemic antibiotics. Okay, remember this statement. You always have to give systemic antibiotics to this patient, otherwise patient can anytime develop cavernous sinus thrombosis. Okay, systemic antibiotic means oral or IV. If the swelling, if the edema is less, you may give oral antibiotic. But if the edema has already spread to the lip and the face, then you must start IV antibiotics, otherwise you can lose the patient, as the patient will develop cavernous sinus thrombosis. All right. Okay, let's come back to our lateral wall of the nose. We have seen the nasal vestibule. Let's talk about the turbinates. So turbinates also we have seen earlier. So we know that there are three turbinates: superior turbinate, middle turbinate, and inferior turbinate. We also discussed previously that the space below each turbinate is known as meatus. So below superior turbinate, we have superior meatus. Below middle turbinate, we have middle meatus. Below inferior turbinate, we have inferior meatus. Right? Okay. Now remember, there is some space above the superior turbinate. Now this space which is above the superior turbinate, this is known as sphenoethmoidal recess. Okay. So this space is known as sphenoethmoidal recess. All right. Now just remember that sometimes other than these, we may also have a fourth turbinate. So we may also have a fourth turbinate above the superior turbinate, and then we call this turbinate as supreme turbinate. Okay, so this is now known as supreme turbinate. That means the space below the supreme turbinate will be known as supreme meatus. This space we had earlier called sphenoethmoidal recess. So remember, sphenoethmoidal recess, the name will change. If there is a supreme turbinate present, you will call it as supreme meatus. But usually there is no supreme turbinate, so we call it as sphenoethmoidal recess. Okay. Now what we can do? We can cut and remove these turbinates. If we remove these turbinates, we can see the underlying meatus more clearly. Okay. So let's do one thing. Let's remove this turbinate. So we look in this photograph, and what do we see? We can see that the turbinates have been cut. So the meatus is visible nicely. Okay. So what do you see? Which is the largest meatus? You see the inferior meatus. This is the largest meatus. So this question is also asked. Inferior meatus is the largest meatus. Right? Okay. Now what do you see in the inferior meatus? You can see over here in the inferior meatus, there is a duct known as nasolacrimal duct. It is opening over here in the inferior meatus. Okay. So remember the nasolacrimal duct, it starts from the lacrimal sac and it goes and opens in the inferior meatus, and it takes all your tears and drain them in the nose in the inferior meatus. Nasolacrimal duct, we also call it as NLD. Right? Okay. So first MCQ about NLD, nasolacrimal duct, is it opens in inferior meatus. Straightforward question. Right? Okay. Next question. NLD, nasolacrimal duct, after DCR surgery. What do you mean by DCR? DCR stands for dacrocystorhinostomy surgery. Okay, dacrocystorhinostomy operation. Now, when do we do dacrocystorhinostomy operation? This is done when there is NLD obstruction. So when the nasolacrimal duct is blocked, NLD obstruction, okay, or there may be chronic dacrocystitis. So that means the lacrimal sac is infected. Dacrocystitis means the lacrimal sac is infected. In fact, the NLD obstruction can lead to chronic dacrocystitis, and the patient comes to you generally with complaint of epiphora, excessive tear production because the tear is not going in the nose, so the tear is coming out from the eyes, so that is known as epiphora. Right? So what will you do? You will do a surgery known as dacrocystorhinostomy. Now what we do in dacrocystorhinostomy, we make another opening of NLD. Okay, so we operate and we make another opening of NLD, and where is it made? This opening is made in the middle meatus. Right? So this big wide opening is made in the middle meatus. Right? Remember, you can do DCR two ways. One is the open DCR, that is done from the face. You give an incision on the face and then you trace the lacrimal sac, and then from the lacrimal sac you make a new opening in the nasal cavity. Okay, this surgery is generally done by ophthalmologists, oculoplastic surgeons. They do it and they try to minimize the amount of scar. But you see, nobody wants a scar on the face, however minimum it may be. So nowadays, what we do as ENT surgeons, we do endoscopic DCR. Okay, so what is done in endoscopic DCR? From inside the nose, you go and you find out the lacrimal sac, and then you open it up and make an opening in the middle meatus. So that is known as endoscopic DCR. The advantage is that there is no scar on the face. Right? So we make an opening for NLD after DCR in middle meatus. The next question about NLD, what is the direction of NLD? Now this question has also been asked in the exam, direction of NLD. So what is the direction? You see, NLD starts from the medial canthus and goes downwards towards the inferior meatus. So it goes downwards, D. Right? It goes downwards, D. What else? You see, the NLD, it goes from medial canthus to this. So it is traveling in a lateral direction. So it is going laterally. Okay. So D was for downwards and L is for laterally. So it is going laterally. And you see, the medial canthus is quite anterior, whereas the opening is little posterior. So it is going posteriorly, or you can say backwards, or you can say inwards. Right? So you can say inwards. I prefer to use the words inwards. It sounds like N. So we have N, L, D. Alright. So direction of NLD. What is the direction? From the name itself you can find out. Direction of NLD is NLD. N for inwards, L for laterally, and D for downwards. Right? Okay. Now before I go forward, let us see one more procedure. Sometimes the NLD, when it is blocked, it is obstructed. We did not do surgery in all the cases. We try to open it up. There are different ways to open it up. Number one, you can do the massage, the lacrimal sac massage over here like this, and try to press and open the NLD. If that is not useful, you can do NLD syringing. Okay, so let's look at the nasolacrimal duct syringing. So what do we do in this syringing? Let's see in this video. So what do we see over here? We can see the nasolacrimal sac, we can see the duct. Okay, so these are the two canaliculi that take up the tears which are produced over here by the lacrimal gland, and they are drained to the nasal cavity. Now look over here, the NLD is obstructed. Now the tears which are coming out are not able to reach, and they cause epiphora. Alright, for this we can do the NLD syringing. Now what is done in NLD syringing is you take a syringe, okay, and you put it into the canaliculi, the upper canaliculi, and you can pass it and try to open the obstruction in the nasolacrimal duct. Okay, so this is how you can do the NLD syringing. Okay, this question was also asked in the exam. Choose the procedure done in following given image. So what can you see over here? You can see over here that this needle is being passed, this syringe is being passed over here so as to open the NLD. So this is nasolacrimal duct NLD syringing. That is the answer to this question. Okay, the remaining three choices: Vidian nerve block, frontal sinus trephination, anterior ethmoidal block. these we will be studying in some time, right? Okay, let's look at this anterior ethmoidal block. So anterior ethmoidal nerve block, this is given, we have the anterior ethmoidal nerve over here in the nose over here, and this block is given when we do rhinoplasty or nasal bone fracture reductions or some other external nasal procedure to decrease the pain on the nose. Okay, it is generally done when you do these surgeries under local anesthesia. All right, so this is the anterior ethmoidal nerve block. All right, remaining we will study later on as the topic comes up. Let's look back at the lateral wall of the nose. So we can see the nasolacrimal duct opening that we have discussed. Let's look at the middle meatus. So what do we have in the middle meatus? As you can see, in the middle meatus, we have number 1 opening over here. That is the opening of maxillary sinus. Number 2, we can see over here that this is the frontal sinus. It is in the frontal bone, and this also drains over here. Okay, so we have the opening of frontal sinus also in the middle meatus. Now, other than that, we can also notice in this area over here, we have the opening of anterior ethmoidal air cells. Remember when I taught you about the paranasal sinuses, I told you that ethmoids are divided into 2 groups, anterior and posterior. So how are they divided? Those ethmoidal cells which open in the middle meatus area, okay, they are known as anterior ethmoids. And those which open in the superior meatus, they are known as posterior ethmoids. Okay, so that means you see over here in the superior meatus, what will open? Posterior ethmoids. Okay, now which sinus is left for us? The sphenoid sinus. And you can see the arrow, the sphenoid sinus is opening over here in this area. What is this area? This is known as sphenoethmoidal recess above the superior turbinate. Right? Okay, and sometimes this space over here, we may also have a supreme turbinate. So this space will be known as supreme meatus. So if there is a supreme turbinate, then the sphenoid sinus will be opening in supreme meatus. Otherwise, it usually opens in sphenoethmoidal recess. Right? Okay. So remember, in the middle meatus, 3 sinuses are opening together: maxillary sinus, frontal sinus, anterior ethmoids. So this is a very important area. You see, I have circled this area. Why this is important area? This is a very key area. Why? Because if there is a mass over here, there is a polyp over here, something is present over here, it will block all the 3 sinuses. If there is an infection in this area, it can again spread to all the 3 sinuses. So this is a very important area in the lateral wall of nasal cavity, and we call it as osteomeatal complex, OMC, osteomeatal complex. Right? Okay. Now, this was the lateral wall of the nose. Let's discuss the bony anatomy of lateral wall of nose. Let's see how many bones they form the lateral wall of the nose. Okay, so as you can see in this photograph, there are a lot of bones which are contributing. How many bones in total? In total, we have 8 bones. Okay, we have 8 bones that contribute to the lateral wall, and we can remember them by the formula 4 plus 4. Okay, so there are 4 big bones, 4 major bones, and 4 small bones. So let's see what are the 4 bones. Number 1, let's look over here. We have the frontal bone. So as you can see over here, there is the frontal bone. Okay, you can see the frontal sinus, identify the frontal sinus, so we have the frontal bone. Number 2, we know we have the ethmoid bone. So it is forming the roof, it is forming the lateral wall, so we can see the ethmoid bone. Okay, what contribution you can see from the ethmoid bone? You can see over here there is superior turbinate, you can see over here there is middle turbinate, so that is formed by the ethmoid bone. What else can we see? Yes, we can see over here the sphenoid sinus, so the sphenoid bone is also contributing to the lateral wall. And number 4, you can see this pink color bone, that is the maxilla. Okay, so what you notice, you have frontal, ethmoid, sphenoid, maxilla. So all the four paranasal sinus bones, they contribute to the lateral wall of nose, right? Okay, so remember the first four that I told you, 4 plus 4, the first four means the paranasal sinus bones. Easy to remember now. Let's talk about the next four. The next four, we have the nasal bone. Okay, you can notice over here, we have the nasal bone. Number 6, we have the inferior turbinate. Now remember, important MCQ question. You can see over in this diagram, this inferior turbinate, this is an individual bone. It is not a part of any bone. Okay, this question has been asked in the exam multiple times. Inferior turbinate is a part of which bone? Answer is none of the above. It is not a part of any bone. It is a individual bone. Okay, which turbinates are part? Middle turbinate, superior turbinate. You see, these are parts of ethmoid bone. Okay, whereas the inferior turbinate is an individual bone. All right. Okay, what else do we have? Number 7 over here, we have the blue color bone, the palatine bone. The palatine bone is a L-shaped bone. Okay, now this L-shaped bone has two parts. It has a horizontal process, it has a perpendicular process. The horizontal process of the two sides comes and meet and it forms the hard palate. Okay, remember I told you hard palate is formed anteriorly by maxilla, posteriorly by the palatine bones. So the palatine bone horizontal part, it forms the horizontal plate forms the hard palate. Now the perpendicular plate, it goes and contributes to the lateral wall of the nose. Okay, so 7 bones we have seen. The 8th bone, you can see a small green color bone anterior to ethmoid over here, and that is your lacrimal bone. Okay, so that's your lacrimal bone, the 8th bone that we see over here, and these bones, they contribute to the lateral wall of the nose, right? Okay, so this was the lateral wall that we have discussed. Let us now talk about the medial wall, that is the nasal septum. Okay, so this is the photograph of the medial wall, the nasal septum, that divides the nose into two nasal cavities. Now, we have already studied a little bit about the nasal septum. The nasal septum, let's talk in detail. The nasal septum, it consists of 3 parts. What are the 3 parts of nasal septum? Number 1, we have the columellar septum. So this columellar septum, I have already taught you earlier also in the external nose anatomy, that this columellar septum is formed by the medial crus of alar cartilage, lower lateral cartilage. The 2 medial crus of the alar cartilage, they meet and they form the columellar septum. Okay, then we have the membranous septum, and we have the septum proper. Okay, so there are 3 parts of the nasal septum. Let's discuss these 3 parts in this diagram. Number 1, we can see over here that this is the medial crus of the alar cartilage that forms the columellar septum. Just behind that, we have a very small area where there is no bone or cartilage. This very small area is known as membranous septum. Okay, there is no bone or cartilage over here. Remember, some girls also like to do septal piercing. So if you want to do septal piercing, this is the place where you have to get it done. The membranous septum, the part that does not have any bone or cartilage. So it will be relatively painless. Right? Okay. Now, what else do we have? Behind this membranous septum, we have the septum proper. Okay. So let's see what structures they form the septum proper. All right. Shall we? So let's start from the top. What do we see over here? We can see the frontal sinus. Okay, so that's the frontal sinus. We have the frontal bone, that means, and this frontal bone forms a small spine. We call it as nasal spine of frontal bone. Okay, so we can see a small spine known as nasal spine of frontal bone, which is supporting the nasal bone, right? So you can see that this is supporting the nasal bone over here. So both of them are contributing little bit to the nasal septum. Okay, remember the nasal bone occupies the upper 1/3, the lower 2/3 of the external nose is formed by the cartilaginous structures. Okay, the upper lateral cartilage, the lower lateral cartilage, and these are supported by the septal cartilage. Remember the midline cartilage, septal cartilage, also known as quadrilateral cartilage. Okay, this septal cartilage, it combines superiorly with perpendicular plate of ethmoid bone. So superiorly we have perpendicular plate of ethmoid bone, and posteriorly we have the vomer bone. All right, so this bone and cartilage together, they form the nasal septum. But this septum needs support. So how does it get support? For the support, you see, posteriorly we have a bone known as sphenoid bone. So this sphenoid bone, if you see in the diagram, it forms a rostrum, and this rostrum of sphenoid bone holds the septum like this. So septum is held posteriorly by the rostrum of sphenoid bone, right? This holds the septum, the bone and cartilage plate together. Okay, now the septum also needs support from the floor. What is there on the floor? On the floor we have the heart palate. Heart palate is formed by maxilla and palatine bones that we have just discussed. Okay, now what happens? Suppose this is the septum. Okay, on the two sides we have the two paired bones, maxilla and palatine bones. So what do? When they come and meet together, they form a bony elevation like this. Okay, so they meet and they form a bony elevation like this. This bony elevation is known as crest. Okay, and this crest, it will hold the septum like this. So the septum is held by the crest. So inferiorly we have the crest of maxilla and we have the crest of palatine bone, right? Okay, so how many bones you can see contributing to the nasal septum? 7 bones. Let's remember them. Okay, let's quickly redo it and let's remember them. So how can we remember the bones which are contributing to nasal septum? How can we? There are 7 bones, and now our formula to remember them is 4 plus 3. So what do I mean by 4 plus 3? Let's look over here. What was number 1? Number 1 was nasal spine of frontal bone. So we have the frontal bone. What was number 3? Number 3 was perpendicular plate of ethmoid. So we have the ethmoid bone. Number 5 was rostrum of sphenoid. So we have the sphenoid. Okay. Number 6 was crest of maxilla. So we have the maxilla. That means 1, 3, 5, 6. We have all the 4 paranasal sinus bones. So first 4 bones were the paranasal sinus bones. Right? Okay. What else do we have? We have the nasal bone. So in the remaining 3, remember when we discussed about the lateral wall, the nasal bone was there also in the lateral wall. What else do we have? We have the vomer and we have the palatine bone. Remember, palatine bone was also there in the lateral wall of nose, the perpendicular plate. The horizontal plate forms the crest and the crest is there in the septum. Okay. Now, which bone was not there in the lateral wall? Vomer. Okay. So remember, vomer is exclusive to nasal septum. Okay. Vomer is exclusive to nasal septum. Similarly, lacrimal bone and inferior turbinate are exclusive to lateral wall. And this question is asked in the exam, which of the following bones does not contribute to nasal septum? If this question is asked, generally the answer given to you is lacrimal bone, because they know turbinate is on the lateral wall, so that is very easy. So lacrimal bone you may confuse. So lacrimal bone is on the lateral wall. It does not contribute to nasal septum. Septum is the medial wall. Similarly, if the question is given reverse, vomer is in the septum and vomer does not contribute to the lateral wall. Is that all right? Okay, so this was the septum proper. Remember, this was the septum proper, one part. There were two more parts that I have told you, columellar septum and the septum, the membranous septum behind it. Right? Okay, so that was the nasal septum. Now, before we finish this topic, let us discuss a video of the skull where we can understand the skull anatomy, as well as we can discuss all these bones that we have just taught. Okay, so that we will improve our understanding of the nasal bone anatomy. Right? Okay, so this is the video of the skull. You can see the skull. The skull is formed by two parts. The upper part is the cranial cavity. The lower part is the facial skeleton. Right? Now the cranial cavity is formed by different bones which are joined together by special fibrous joints. As you can see over here, these fibrous joints are known as sutures. And what do we have over here in the base of skull? We have different foramens, fissures, canals. Important structures pass through these canals, and they are very, very important MCQs. Okay, in every exam you'll get 1 or 2 MCQs from these fissures, foramens and canals. Okay, now what all you have to remember in these? You have to remember, number 1, the name of canal. Okay, name means name and the location. The examiner may ask you, in which bone is the foramen magnum situated? Okay, so you have to remember occipital bone. Right? Now instead of doing that, he can also give you this photograph and he can put an arrow and he can tell you identify the foramen. So you should have a pictorial representation of that foramen position in your brain. Okay, so you should be able to identify the location of foramen if an arrow is marked to you. This is very important. Nowadays, a lot of image-based questions are coming. So you have to remember the foramen name, its location. Location means where it is in the bone and in the picture also. Then you must know what structures are passing through it. Right? And you should know the syndromes. If there is some syndrome associated with the foramen. Most of the foramens are associated with very important clinical neurological syndromes, and you must know them. Right? So it's a very important question that is asked in the exam. Anyways, let's go forward and further continue our discussion on this video. So let's look at the different bones that form the skull. So what all bones do we know over here? Let's start with this bone. What is this bone? That is the occipital bone. Okay. Then we have over here the parietal bone, the temporal bone we discuss in ear, frontal bone we discuss in starting of nose, nasal bone, zygomatic bone, maxilla and mandible. Let's remove these bones. Okay. So let's remove these bones. Now we have removed these bones. What do we get right in the center? You see? What do we have right in the center? In the center right we have the sphenoid bone. In the center of the skull you can see this is the unpaired bone. Okay, you can see this sphenoid bone, this is the unpaired bone, it looks like a bat. So it has been classically described as a bat. In the center of this bone we have the body, on the sides we have over here the greater wing, we have the lesser wing, and these claw-like structure, this is the pterygoid process, having a medial pterygoid plate and a lateral pterygoid plate. Okay, now you see the body of this sphenoid bone, it is nematized, it has air, and it is forming the sphenoid sinus. Right? Between the greater wing and the lesser wing, you can see a fissure over here. This is known as superior orbital fissure. Right? And important structures pass through it. We will be discussing sphenoid bone in detail later on also. I'm just giving you an overview that this is the superior orbital fissure. So this question is asked, superior orbital fissure lies between greater wing and lesser wing. Okay, what structures pass through? We have the cranial nerve, third, fourth, V1 and sixth cranial nerve passing through it. Okay, we may also have superior ophthalmic vein passing through it. Now what else do we have above that? Above that we have the optic canal. Okay, so where is the optic canal? Question comes, in which bone is the optic canal? Now you remember optic canal is in the sphenoid bone. Very good. The option comes as greater wing of sphenoid, lesser wing of sphenoid, body of sphenoid, pterygoid process of sphenoid. So you have to be very specific. See, the optic canal is over here in the lesser wing of sphenoid. Now what passes through the optic canal? Next question. What passes through the optic canal? So we have the optic nerve. Anything else? We have the ophthalmic artery. Okay. What else do we have? We have central vein of retina. So this question comes in the exam. Which of the following structure is not passing through optic canal? So remember I told you we have the ophthalmic artery, we have the optic nerve, we have the central vein of retina. Ophthalmic vein, however, does not passes through this. It is passing through the superior orbital fissure. Okay, so remember superior ophthalmic vein passes through the superior orbital fissure. Inferior ophthalmic vein can also pass through superior orbital fissure. Sometimes it passes through inferior orbital fissure. Anyways, okay, so this is important. What else can we see over here? We can see this is the pterygoid process and over here is the pterygoid canal. Remember here we discussed in the facial nerve, this is also known as Vidian canal. What comes out of here? The Vidian nerve. The Vidian nerve comes out of the Vidian canal, also known as pterygoid canal. And posterior superior to this over here, we can see there is another opening. This is foramen rotundum. Okay, and foramen rotundum, the maxillary nerve comes out of it. The V2 nerve, maxillary nerve. Anyways, we'll discuss it later. You can see the body, lesser wing, greater wing. Now I am rotating the skull. So the sphenoid bone is also rotating. Okay. Now what do we have over here? This highlighted area. What is this? This lies above the sphenoid sinus. Okay. This is the place where we have the pituitary gland. And this place is known as sella turcica. Okay. Right. So we have the pituitary gland over here. Okay. So once again we rotate it back. So remember the sphenoid sinus superior relation is with the pituitary gland. And now what do we have in front of this sphenoid? You can see this unpaired bone. We have already discussed this unpaired bone earlier. Just try to remember this over here is the perpendicular plate. This is the crista galli. Yes, I am talking about the ethmoid bone. So that is another unpaired bone, okay, forms the right and the left ethmoid sinuses. So that lies anterior to the sphenoid bone over here. We can see the ethmoid bone. Okay, perpendicular plate is being highlighted. Now if I turn over here, you can see in the superior part the crista galli. We have discussed it. Okay, what do you see on the sides of crista galli? On the sides of crista galli, you can see bone plate with lot of holes in it. That is the cribriform plate. Okay, it has holes in it, and this is the thinnest bone in the body. Now what passes through these holes? We have the olfactory nerve fibers. So there is an olfactory bulb above the cribriform plate. From the bulb comes out the olfactory nerve fibers. They go through the cribriform plate and they supply the superior part of the nasal cavity, where they form the sense organ known as olfactory fossa. Right? Okay. So this is the cribriform plate of ethmoid bone. Again, we have discussed this earlier. Okay. Now, what else do you see over here? Now, what do you see? These are two bones. It's a paired bone. Which bone? L-shaped bone you can see over here. The L-shaped bone consisting of perpendicular plate and the horizontal plate. This is the palatine bone. You can see the horizontal plate is also forming a little bit of crest. Okay, the crest of palatine bone that holds the septum in between. Right? So that is the palatine bone shown to you over here. All right. Okay. We can now see a pair of bones. Again, you can see blue color demarcated pair of bones. And which are these bones? These are thin bones anterior to the ethmoid, paired bone in the lateral wall. These are your lacrimal bones. Okay, and the lacrimal bone, as you can see over here on the lateral aspect, that means the part which is facing the orbit, they have lacrimal fossa. In the lacrimal fossa is present lacrimal sac, and from here starts your nasolacrimal duct and goes to the inferior meatus where it opens up, right? So these are the lacrimal bones. I have told you lacrimal bones are exclusive to lateral wall. Okay, and now you can see a bone which is exclusive to septum. Right in the center posterior part of septum we have this bone. I just showed you in the diagram. Now you are looking in the video. This bone is your vomer. Okay, it is exclusive to nasal septum, vomer bone. All right, so these were the bones that I wanted to teach you, and when we can put back, we can have the skull. All right, so I hope this video helps you further enhance your knowledge of the nasal anatomy. Thank you.